This video is going to be going over 10 quite unusual psychological disorders. Unusual and quite rare as well, affecting particularly small percentages of the population, and in some cases being located directly to one geographical or cultural position. The first disorder I'm going to be discussing is the Paris Syndrome, also called the Jerusalem Syndrome. And the Paris Syndrome affects a very small number of people in a very specific demographic, mainly Japanese tourists who go to Paris. 10 to 20 people a year fall victim to the condition when they visit the city of love and realize that it isn't quite what they expected it to be. The French capital has been idealized by the media and popular culture, especially in Japan, where ads and films depict the place as being filled with rich, skinny and fashionable people who chat at cafes and drink coffee and eat baguettes, strolling by the Eiffel Tower and shop for designer clothes. When some Japanese travelers are confronted with the less romantic reality, they experience delusions, dizziness, hallucinations, sweatings, and feelings of persecution. The shock of coming to grips with a city that is indifferent to their presence and looks nothing like their imagination has been said to launch tourists into psychological tailspins, which, at least in several cases per year, necessitates the patient being flown back to his or her country under medical supervision. The Japanese embassy has now opened up a hotline to help tourists who may experience some of these feelings. The second disorder is the Fregoli Delusion. Is that person sitting next to you on the bus a complete stranger, or is it your grandma in disguise? People in the throes of a Fregoli delusion can't quite be sure. This is a very rare disorder, and it causes people to believe that a person around them, typically someone they don't know, is actually another person who they do know, which is not actually present. One of the first instances recorded in 1927, where one woman became convinced that her two favorite actresses were following her around disguised as strangers and even her friends. The next disorder is the Alice in Wonderland Syndrome, also known as the Todd Syndrome. Alice in Wonderland Syndrome is a neurologic condition in which a patient's sense of body image, space, and/or time is distorted. Those experience Alice in Wonderland Syndrome may have hallucinations, sensory distortions, and an altered sense of velocity. Alice in Wonderland Syndrome results from a change in perception. Though there are many symptoms, the most prevalent one is altered body image. Patients are confused about the size and shape of parts of their bodies. These symptoms can trigger panic and fear responses, and is often associated with frequent migraines, brain tumors, or drug use. It can affect children between the ages of 5 and 10. Next is the Crust Syndrome, and this syndrome is named for Joseph Capgras, a French psychiatrist who explored the illusion of doubles. Those with Capgras syndrome hold the delusional belief that someone in their life, usually a spouse, a close friend, or family member, has been replaced by an imposter. It can occur in patients with schizophrenia, dementia, epilepsy, and after traumatic brain injury. Treatment approaches mirror those used for underlying disorders and often include antipsychotic medication. Alien Hand Syndrome. Alien Hand Syndrome is characterized by the belief that one's hand does not belong to oneself, but that it has its own life. Individuals experience alien hand syndrome have normal sensation but feel that their hand is autonomous, with a will of its own. Those with alien hand syndrome may personify the limb as a separate entity. The unaffected hand is under the individual's control, while the affected hand has its own agenda. This syndrome may occur in individuals who have damage to the corpus callosum, which connects the two cerebral hemispheres of the brain. Other causes include stroke and damage to the parietal lobe, The hand then appears to be in an intermanual conflict or ideomotor apraxia, meaning that they act in opposition to one another. Exploding head syndrome. Exploding head syndrome is the colorful name given to the experience of loud noises during sleep-wake and wake-sleep transition that result in abrupt arousal and fright. The specific sounds reported during episodes of exploding head syndrome are quite variable and can include perceptions of fireworks, lightning cracks, or nondescript screaming. Visual experiences such as light flashes may also be involved. A variety of theories exist for exploding syndrome, but the most popular of these implicates abnormal surges of neuronal activity within the brainstem during sleep-wake transition surges, which are then perceived as loud and startling sounds. Although episodes are more common than initially thought and can have important clinical impacts on sufferers, exploding head syndrome is still a relatively unknown disorder. Further, its characteristic symptoms have been incorporated into several current conspiracy theories. The next syndrome is called Coro. Coro is a genital retraction syndrome. Coro involves the spurious belief that certain body parts, such as the penis in men and the vulva in women, are retracting into the body. The origin of the word Coro is connected to the Malaysian term for the retracting of a turtle's head. Upon complete retraction of the body part in question, death is the feared consequence. The first description of Coro-like symptoms, with some similarity to panic disorder symptomatology, can be found in ancient Chinese medical records that are over 2,000 years old. Although Coro is often thought to be a disorder associated with Asian populations, cases in other parts of the world have been regularly reported. Moreover, Coro can occur as individualized cases or full-blown epidemics. The next syndrome is one that some of you may be familiar with, and that is Munchausen Syndrome, also known as Munchausen by Proxy Syndrome. This is a fictitious disorder, and it is a condition in which a person, without malingering motive, acts as if they have an illness by deliberately producing, feigning, or exaggerating symptoms purely to attain, for themselves or for another, a patient's role. People with a fictitious disorder may produce symptoms by contaminating urine samples, taking hallucinogens, injecting fecal matter to produce abscesses, and similar behavior. Munchausen by proxy is a condition in which a person deliberately produces, feigns, or exaggerates a symptom of somebody in their care. In either case, Munchausen by proxy or Munchausen syndrome, the perpetrator's motive is to perpetrate fictitious disorders, either as a patient or by proxy as a caregiver, in order to attain, for themselves or for another, a patient's role. For a person with fictitious disorders, the primary aim is to obtain sympathy, nurturance, and attention accompanying the sick role. Stendhal syndrome. Those with Stendhal syndrome experience physical and emotional anxiety, as well as panic attacks, dissociative experiences, confusions, and hallucinations when exposed to art. These symptoms are usually triggered by art that is perceived as particularly beautiful, or when the individual is exposed to large quantities of art that are concentrated in a single place, such as a museum or gallery. Individuals may experience similar reactions to beauty in nature. The syndrome is named after the 19th century French author who experienced the symptoms during a trip to Florence in 1817. And finally, there is apotemnophilia, also known as body integrity disorder. Apotemnophilia is characterized by the overwhelming desire to amputate healthy parts of the body. Though not much is known about the disorder, it is believed to be neurological. Those affected may attempt to mutilate or amputate their own limbs or damage the limbs so that a surgical amputation is necessary. Apotemnophilia may be related to right parietal lobe damage in the brain. The condition is challenging to treat because people experience it often do not seek treatment. Merely, they seek to get a specific limb amputated. And that's all for this video. I hope you found these disorders as interesting as I did when looking them up. If you did enjoy it, give the video a like, and if you want similar types of videos, hit the subscribe button. Yo.